Hi everyone, it's Nicole here with our Children Our Future, La Cloche Early On Child and Family Center. Thank you so much for joining me today. Today we are talking everything pacifiers. So we are talking about, is it okay to introduce a pacifier? When is the best time? What are some advantages, disadvantages, and some do's and don'ts when it comes to pacifiers, as well as how to help your child wean off of a pacifier. So babies are naturally born with a sucking reflex. It's one of the very first reflexes they have, and they are prone to suck. If they get fingers in their mouth, they're probably going to suck on that. So sometimes having a pacifier helps them soothe that sucking reflex. However, it should never be used in place of a hungry baby. But it can definitely help to soothe a child as well. So what are some advantages of using a pacifier? So again, babies are born with this sucking reflex and they're going to suck no matter what. So chances are, if they're not using a pacifier, that they're going to find something else to suck on to soothe that. And for some children, that is their fingers or their thumb. And as much as that is natural and very great, it can be a harder habit to break later on down the road, which could again in turn cause issues with the soft palate on the top of their mouth and their teeth development as well. And the last bit of research is that an advantage to using a pacifier, if your child will take one, is that it might decrease the risk of SIDS, so sudden infant death syndrome, or crib death, because it keeps their body from going into a full state of sleep. So what are some disadvantages of pacifiers? So if a pacifier is not used properly, it can cause issues with breastfeeding. It could cause issues with their teeth, or like I said, the soft palate on the top of their mouth. It can cause an overbite. It could possibly cause ear infections, and even later on, speech and language development as well. The other thing is that homemade pacifiers or sweetened pacifiers, so dipping their pacifier into food, liquids of any sort other than water, could cause tooth decay, as well as tying the pacifier around the baby's neck. They're not recommended, which could lead to injury or death. So if you choose to use a pacifier, make sure you're doing so safely and using it as directed and wisely. So here's some really great tips, do's and don'ts of using a pacifier. So it's best not to introduce a pacifier until your child has fully established breastfeeding. If you choose to bottle feed, then a pacifier can be introduced earlier. However, because of breastfeeding, sometimes there is nipple confusion, and a baby will not be able to latch effectively onto the breast if they are used to sucking on the pacifier, just based on the different shapes and things like that. If you have worries or concerns, or you want to know, what the recommended age is, it's best to talk to your doctor, your midwife, lactation consultant, just to help, kind of put you at comfort and to give you a little bit more information about that. So again, pacifiers should never be given to a baby that's hungry, because when they're crying a hunger cry, it means that they need something specific. It's not that they are just cranky, they need food. So by using a pacifier instead of feeding them could cause growth issues and further hunger. Always try and make sure that you've checked all of the other possibilities. So again, hunger, make sure if they're tired, if they're bored, check all these things before giving them pacifier. Try and resolve maybe what the problem is beforehand, instead of always using the pacifier as a first resort. Always make sure that you're sterilizing your pacifiers, whether you're using a proper sterilization piece of equipment. There are lots out there on the market now, or you could simply put your pacifier in boiling water for 5 minutes before the first use. Let it completely cool down after that, and then wash it with soapy water on a regular basis, and sanitize it on a regular basis as well. always following the manufacturer's directions, of course. You always want to check your pacifier for cracks or tears before you give it to your child, just because you don't want a piece to break off while they're sucking on it. Also, sometimes they give pacifiers right after giving medication, and these medications can sometimes actually break down the silicone of the soother or the pacifier itself, which could cause cracks or tears. Also, if they're getting teeth, sometimes they'll chew, and that'll put in little holes in the pacifier as well. Never dip your pacifier in sugar or honey or sweet drinks, because it is damaging to the teeth, as well as honey can cause botulism, which is a type of food poisoning for children younger than a year old. Never tie a pacifier around a baby's neck. Obviously, this is a cause for strangulation and death. Sometimes you can buy short ribbons or clips that you can attach to the babies that will not wrap around their necks. Most times you can get that at any store that sells pacifiers. Never make your own pacifier by using bottle nipples or caps or any other materials, as they can be a choking hazard. Never let your older children run around or walk around with their pacifier in all day long, because again, this might affect the way their teeth are going to shape. This might affect the soft palate on the top of their mouth, as well as their speech and language development, because they are not taking it out to talk, they're learning to talk around it. And if they can avoid it, never let your baby chew on their pacifier, because it could break down or a piece could come off, which could cause choking. Always follow the directions and throw away your pacifier and the recommended time, or if it is damaged, and follow the age recommendations for that pacifier, because there are different strengths of material that are used and different sizes of nipples or nubs that are used as well on the pacifiers. So the big question that we do get a lot is, how do I help my child wean off of their pacifier? And this can be really difficult, as some children become very attached to their pacifier. Oftentimes it's recommended that, the parents start to wean their child off of their pacifier around the age of 12 months. Again, this has to do with teeth development and speech development. And so in order to do that, they recommend limiting the time that your child has the pacifier. So limit it down to naps or sleeping time only, or for comfort if they're sick or something like that, but don't let them have it all the time or whenever they want. Never use taking away their soother as a punishment or humiliation for the child, because it's going to make them feel worse about giving up that pacifier. Sometimes if they're involved in the decision of getting rid of their pacifiers, or you have a new sibling coming in, it might be a great time to transition out of the use of the pacifier. Some parents have left it for a tooth fairy or a pacifier fairy if you wish, and it would disappear overnight while they're sleeping, maybe leaving them a small gift or a note expressing that another child would really love to use this. As well. And sometimes if it's their choice, they feel like they have more power in the decision. Praise your child when they remember to leave it in their room or in their crib, and if they are willing to give it up, let them know that you're proud of them and that this is a big decision, and that they're, becoming a big child now, and there's going to be so many more things they get to do. Offering them another option of comfort. So whether that be a blankie, a stuffy, introduce it while they have their pacifier. Kind of get them hooked on another kind of comfort tool, and this will help be able to relieve some of that discomfort of losing that pacifier. And the biggest thing, and this is so difficult, especially when you have a child that is really attached, is that parents need to say no. Once you've taken that pacifier away, and this is a decision that no more, you cannot give in and give it back to them, because then that creates a cycle that if I make enough fuss, if I cry enough, if I put up enough of a fight, my parents will just give in. So please stand your guns, be consistent, and don't let the rules slide back and forth. And you will notice it might be a rough little bit, but over time they should be able to drop that soother. So we definitely don't recommend cutting or altering them in any way, simply because then it becomes a choking hazard. So I know a lot of parents have said that before, just cut the tips off of them or cut the, it's a really unsafe method to use. So we don't encourage that method as well. But if you have any other tips out there that you would love to share with us or other parents, we would be very happy to hear what those are. So thanks everybody for joining me today, and we will see you again next time. Bye.